Welcome to On Call, Paging the Frontlines of the Future, a podcast powered by Project Unity. I'm Hargun Satcher, your host, and a proud member of Project Unity, a student-led initiative transforming how we talk about healthcare. At Project Unity, we believe meaningful health innovation begins by listening, not just to professionals, but to young people living and leading within today's health systems. This podcast brings youth into dialogue with experts across medicine, public health, and digital health to explore real stories, pressing challenges, and bold ideas, reshaping health equity in schools, clinics, and communities. Whether you're a student leader, an educator, or a healthcare professional, you're in the right place. This is where emerging voices and experienced minds come together to reimagine the future of health. Today, we are honored to welcome a leader and educator advancing health equity through behavioral science, cultural insight, and community engagement. Dr. Cassandra S. Diep, PhD. She serves as Associate Teaching Professor in the Department of Kinesiology at Rice University, advises health science students, and co-directs the Rice UT Public Health Scholars Program. Dr. Diep holds a BA in Kinesiology from Rice, an MS and PhD in Health Education from Texas A&M University, and completed a postdoctorate fellowship in behavioral nutrition at Baylor College of Medicine. Her research spans health disparities in dietary and physical activity behaviors, obesity prevention, and Asian American health, integrating behavioral theory and cultural context into public health strategies. From her work at MD Anderson Cancer Center to her current role in shaping the next generation of public health leaders, Dr. Diep's mission has consistently focused on bridging research, education, and community partnership. Dr. Diep, it's an absolute privilege to have you here with us. To start, could you share a little bit about your journey and what continues to inspire you at work at the intersection of public health, behavioral research, and equity?
Thank you for having me here today, Hargan. I really appreciate the invitation and this opportunity to share more about myself and then have this conversation with you. So you asked me to share about my journey. I think you already did a great job with that bio. I don't know what more I can add, but I can kind of fill between the lines, some things that you didn't say that I think is very important to my journey. I will say that when I started my educational career, I wanted to be pre-med. Like that was my goal. I entered college, pre-med. But as a child of immigrants, I felt that there was more family pressures on me, parental pressures on me to pursue that path. Than there was this internal passion within me to pursue medicine. And it took a lot of failures during my undergraduate years at Rice to realize that medicine was not my path. I admire physicians, I admire healthcare professionals, but I myself was not going to be a healthcare professional. I didn't do well in certain courses. I didn't see the world in the micro lens. I didn't see the world on the downstream treatment side. Instead, I really wanted to make an impact with prevention, with upstream factors. And so after a lot of searching different majors, courses, I found public health. And I love public health. Honestly, when I went to graduate school, I still wasn't convinced that public health was my path. I went to graduate school still thinking I would eventually go into medicine, but it wasn't until I started my master's program, I learned about the research that could be done in public health. I learned about the mindset that public health professionals have, this idea of really having a holistic understanding of what impacts health, and then what can we do to prevent a lot of those downstream issues that we see in healthcare settings or in the world. I fell in love and I decided to continue on with my my master's, my PhD, and continue my journey in public health.
That's awesome. Thank you so much
Yeah.
for sharing. I'm sure a lot of people can relate. I know the interest in science usually delves from wanting to be a healthcare professional, and then we realize how many possibilities are out there. That's awesome. Thank you so much. So we'll move on a little bit more about your personal journey and motivation. Your work connects behavioral theory, nutrition, and health disparities. So what first drew you to this intersection specifically, and were there personal or professional moments that shaped your path? I know you discussed a little bit about how you went into public health, but was there anything specific about this intersection?
Yeah, so I will say what really drew me into the areas that I'm in is my lived experiences. So I mentioned that I'm a child of immigrants. Specifically, I'm Cambodian American. And so as a Cambodian American, like I became part of this model minority, right? This idea that all Asians are successful, that they work hard. They come here as immigrants, they work hard, and they succeed in this country. And so I internalized that. But there was also a lot of challenges that came with this myth of being a model minority, this idea that we're all successful, that we can all be successful, but Asians, there's so much diversity in Asians. Cambodians are actually some of the least successful. I don't know if I should say that term, but in terms of educational attainment and income, they have some of the lowest educational attainment and the lowest income of all Asian ethnic groups. And so for me as a Cambodian American to be lumped in with more successful Asians was very challenging for me. It made me question my ability to do well in school. It questioned like if the struggles I faced were real or if they were not real, if like I should try harder, if I work harder, do I need to stop complaining? Do I need to just like work harder? And then I could be successful. And so those experiences motivated me towards health disparities, particularly in Asian populations. And so if we think about like my passion area, it's Asian American health disparities. That's where I want to focus. A lot of my work is informed by my own experiences. So for my dissertation and for my postdoc, I looked at dietary acculturation, like this idea that immigrants will change dietary behaviors or in what they eat when they become exposed to a new culture and new environment. And so that's something that I was interested in. I was also interested in disaggregating Asians, like instead of combining them all together, really looking at obesity risk among different Asian ethnic groups, looking at different experiences of Asian ethnic groups rather than lumping them all together. And so overall, my lived experiences as a Cambodian American who was struggling with the model minority myth is what motivated me to pursue health disparities, particularly within Asian populations. And I want to share something that happened when I was a postdoc. I received this competitive postdoctoral fellowship at Baylor College of Medicine. Baylor is a great institution. I'm not going to say anything bad about Baylor and I'm not going to name any names, but there was a meeting where all the postdocs went around and shared their research interests and what they wanted to pursue during their postdoc. So I mentioned that I was interested in Asian American health disparities, and acculturation, diet, model minority myths, etc. And the director of this postdoc, so MD trained, leading researcher, leading physician scientist, specifically said to me, Asians are healthy. There are no disparities. Asians don't experience disparities. And that's just an example of that, like a reason I keep forward with this is because we have to like dispel that myth. This idea that Asians are healthy, that Asians are successful, that they have no health issues, that they don't face any challenges. I mean, that's something that I feel very passionate about doing.
Well, thank you so much for sharing and also sharing that vulnerable story and how it fueled your passion into not only your personal ideas, but everything that you experienced and heard from the outside community as well. So thank you so much for sharing. And then we'll go a little bit into your real world impact and your research. So we know that you're extremely passionate and your studies have addressed obesity prevention through culturally tailored interventions within specific groups of the Asian community. So could you share an example of how your research has translated into tangible changes in a community?
So I will share that most of my research has been more on the exploratory, better understanding the issues problem than it has been on the intervention, designing solution side of the research spectrum. So when I started off with Asian American health disparities research, knew I wanted to create a research trajectory from understanding the issue to creating an intervention. And so a lot of my research was more about understanding the issue within different populations. So taking big data sets and understanding what's the obesity rate, what are the obesity risks among these different Asian populations. Conducting qualitative interviews with children to ask more about what they eat, why they eat. And the goal was to then take that information and come up with an intervention, a strategy. And I was working on an obesity intervention for Filipino Americans, and we specifically chose Filipino Americans because among Asian ethnic groups, Filipinos have a high rate of obesity.
Mhm.
And so that was something that I was working on. I had a grant put together, and then this opportunity to go into teaching happened. And so I pivoted away from research and went into teaching. And so unfortunately, I can't quite answer that question because I haven't been as impactful in my research as others have been. But I think something to share is that it's really hard to do Asian American health disparities research. It
Mhm.
was very challenging for me to find grants to fund my studies. And so that was a big driver for why I went away from research, from pursuing that intervention, is
Mhm.
because like it was very difficult to find research funding. There was a study that was published a couple of years ago looking at the National Institutes of Health and
Mhm.
funding of different racial ethnic populations. And they found that less than 0.1% of the NIH budget had funded research looking at Asian Americans. And it's not that these studies, these proposals were just exclusively focused on Asian Americans, it's
Mhm.
that they included Asian Americans. So
Wow.
0.1%. And so you can see that that was a big reason why I
Mhm.
shifted away from research into teaching. And so a lot of the work that I do in Asian American research now is more at a, not so much a research side, but more advocacy, more awareness side. So the example I'll give is we have every other year, there's the Asian American Health Coalition
Mhm.
and Hope Clinic, which is a federally qualified health center in Houston. We hold an AAPI Health Summit every few years. And so the upcoming summit is in 2026 in January, and I am co-chairing it. And so we're bringing in different researchers, different experts related to AAPI health and putting together this summit. And so for me, while I'm not active in research, and have specific studies in Asian American health currently, I do a lot of advocacy, a lot of awareness, a lot of like still pushing that conversation forward that needs to happen.
Awesome. Thank you so much. And I'm sure the work that you have done just exploring data sets has allowed others to form tangible, small results in their own personal lives as well. So thank you.
I hope so.
Yes, for sure. During your postdoctorate work at Baylor College of Medicine and your time at MD Anderson, you blended academic research with community partnerships. So, what lessons did you take from these experiences about making public health work sustainable?
The community is everything.
Hmm.
Oftentimes, when we're trained in graduate school, especially for a PhD, we are trained to believe that we're the experts. Like
Okay.
we have these fancy degrees from these institutions. We've
Hmm.
done a lot of coursework in these disciplines. We've done research in these disciplines, so we're the expert. And what I've learned from my time at Baylor and especially at MD Anderson, because I was part of a community engaged center where the key pillar of that center was working with the community. What I've learned is that academics aren't experts in everything. Yes,
Hmm.
we have expertise in research. We have expertise in designing a scientific study,
Right.
but we don't have expertise in the lived experiences of the people, the communities that we want to help. Like even me as an Asian American, I'm Cambodian American. I can't speak for every Asian ethnic group. And even
Mhm.
as a Cambodian American, my experiences are going to be different than my parents' experiences, my grandparents' experiences, or experiences of other Cambodians and Cambodian Americans. And so, really forming those partnerships with community members when we think about what are they interested in?
Sure.
Like, oftentimes, as researchers, we go in and say, well, obviously, the issue here is that overweight and obesity. That's
Mhm.
the issue. But then if you have dialogues, conversations with the community members, you start to realize that maybe there are some, what are the challenges that they're facing? What do they think are their pressing issues? And having them help think of a research study, help them, empower them to collect data, to analyze results, to understand what do the results mean, and then what does that mean moving forward. And I'll
Thank
share, if you don't mind, I'll share an example from my time at MD Anderson that I continued while I was at Rice. We had a small grant to look at the 5 largest Asian ethnic groups in the Houston area, and we wanted to understand cancer risk and perceptions.
Mhm.
So we made sure we formed collaborations with community organizations in each of these groups. So for instance, the Chinese American community, we formed relationships with Chinese churches, with Chinese community centers, Chinese healthcare professional organizations. And we made sure that they were part of the research grant, part of the planning process, part of data collection, part of analyzing and disseminating. And what we found, like something interesting that we found was skin cancer, sunscreen protection. So
Mhm.
we're often told, oh, you should wear sunscreen because it protects against potential skin cancer, right? It reduces the risk of skin cancer. And what we found when we talked to the Korean community is that it wasn't skin cancer that was their main reason for putting on sunscreen. It was more for aging, anti-aging, and cosmetic reasons. And so if we're then going to design an intervention or a strategy for the Korean American or Korean community, maybe we shouldn't focus on skin cancer. Yes, that's something we should include, but also incorporate cosmetic reasons for sunscreen and the anti-aging reasons for sunscreen. So really tying it back to what they are interested in.
Absolutely. And this is actually a great piece that we get from a lot of researchers that we interview as well, is that to really highlight the community aspect of the community that you're going into research and what would best fit their needs and their idea of what would best fit their community. So thank you so much for sharing. And now we'll dive a little bit into education, mentorship, and equity. So at Rice, you not only teach, but mentor students preparing for careers in public health and medicine. So, what qualities do you hope your students develop as future leaders?
The qualities I hope they develop. Critical thinking is
Mhm.
something I really think is so crucial today,
Mhm.
especially with misinformation, disinformation, and social media. It's really easy to just see a headline or see a post and believe it. And
100.
what I really want students to gain is to critically think about what they see and don't just believe everything that they see. And even if there's something that seems reasonable, really dig deeper and make sure that you understand that headline or that post or whatever it is. So critical thinking is one. And I would say the other thing I want students to gain is a passion for public health. Like, I know that's obvious. Like, I teach public health. I want students to be passionate about public health. But what I tell students is you don't have to go into public health as a public health professional
Mhm.
to incorporate our public health lens or think about public health. A lot of my students are pre-med. And
Mhm.
so as future physicians, as future nurses, dentists, healthcare providers, it's really important to have that public health mindset as you approach your work. And so thinking about what are those social determinants of health or non-medical drivers of health
Mhm.
that might be impacting your patient's behavior. Like
Abs-
rather than telling them, I told you to stop smoking, why are you still smoking? And then blaming the patient for still smoking, which is something that I've had happen. Not smoking, but I've felt a lot of victim blaming from healthcare providers towards me. And so that's something I want students to remember is don't victim blame. Think beyond the individual. Think about what are those circumstances that are impacting their behaviors and impacting the health choices that they have.
Absolutely. Thank you. And as a pre med student currently myself, this is definitely great to hear as well, and how we can really integrate these ideas into the future of any profession involved in healthcare. So, this is definitely extremely important. How can higher education better prepare young professionals to address health disparities and design culturally sensitive health interventions?
That's a good question. There's a lot of challenges right now
Mhm.
related to that question. On public health, health disparities are threats to
Mhm.
some people. Some people view them as threats. And so that's a challenge is how can we still push forward advocating for certain populations? How can we push forward these public health ideas
Mhm.
when people are threatened by that? And the other challenge is higher ed is being threatened too. A lot of institutions in Texas, because I'm in Texas, so I can speak about Texas, a lot of faculty are being censored, that they're not allowed to talk about certain topics, they're not allowed to have certain words.
Right.
Even within research, there are certain words that you're not allowed to put in your research proposals. And so
Mhm.
overall, higher ed and public health disparities are being threatened. And so
Yeah.
that's kind of a loaded question right now.
Yeah.
But I will say it's still really important to encourage those critical thinking skills so that students can really evaluate what they are being told or what they hear. That includes questioning me. I might tell you something. It's okay to disagree with me, question it, but the way you get to your own conclusion should be a thoughtful process, not just because you saw something on social media and so you're going to believe that. And so the critical thinking, I think, is really important. And then for me, just really finding these different ways for students to gain that passion.
Mhm.
So in addition to my courses, making sure that students are able to get research experiences, internship experiences, talk to guest speakers, like connect with guest speakers, connect with community. A lot of my courses have a community engagement component. So I bring the community into the classes and then
Mhm.
I try to send students into the community,
That's
because
awesome.
that way you can learn why public health community engagement is so important and
Mhm.
some of the downs, like the impact that public health has. Does that
Mhm.
answer your question?
Yeah. Yes,
Okay.
of thank you for that. And it's actually incredible that you're able to do that and involve community at that firsthand experience for the students who are helping and contributing towards that community as well. So, further, why does the future of healthcare depend on the intersection of medicine and public health working together and not individually?
Yes, I believe everything is connected in this world.
Mhm.
So, do you know the parable of the river story?
I don't, but I would love to hear.
Okay, so it's a common story that I tell to my students, especially in intro public health or to students who are first being exposed to public health. And it's not my story; it's a story that like many people know. And so I will summarize it.
Yeah.
This idea that you're walking along a river and
Mhm.
you see somebody struggling, like drowning and crying for help. So you
Mhm.
jump into the river and you pull this person out. You see another person struggling, and so you go jump into the river and pull this person out, and then so on and so forth until you realize that you don't have the capacity to go and save every single person. So you
Mhm.
start walking upstream to figure out what is going on. That like, why are all these people in the river drowning? And so you see this bridge. It's
Mhm.
a bridge that people are trying to cross
Mhm.
to get to the other side of the river, but there's a hole in the bridge and people are falling into the hole in this bridge and getting swept away in the river. And
Mhm.
so that's parable of the river. The key themes from it is this downstream versus upstream. You know, downstream where all the treatment, saving those who are struggling to swim, the one-on-one interactions that you
Right.
have.
Mhm.
Upstream would be what are those broader, like what is the issue that's resulting in these downstream impact,
Mhm.
and then something like this bigger level change that you can do to prevent all the downstream impact. And so, like, usually people think of medicine as the downstream side and public
Mhm.
health as the upstream side. But
Mhm.
medicine can also be upstream. Like, if
Mhm.
we think about primary care, a lot of like the relationships, like people trust physicians and
Mhm.
the advice that physicians have, issues with our healthcare system, access to health insurance, that could all be upstream. And so
Mhm.
we do need that intersection of medicine and public health and other disciplines to really prevent these downstream issues.
Mhm.
So let me think if I could think of an example. Like I think the pandemic, right?
Mhm.
I used to share this parable of the river a lot during the pandemic. And
Mhm.
the downstream would be all those hospital beds,
Mhm.
the EDs being over like at capacity,
Right.
having to turn away people, etc. Upstream could be like vaccination. And so if we use vaccination as an example, so science is important. Those scientists who are actually testing the clinical trials, who are testing, coming up with the vaccines, testing the vaccines, that's important. But then once the vaccines are made, we had the issue of people going and getting the vaccines. And so
Mhm.
that involved working with sports arenas to open up vaccination camps. So you had to bring in sports organizations. They're working with local pharmacies, community pharmacies. But even then, you have the vaccines and vaccine clinics. If people don't trust the vaccine or healthcare or the government, they're not going to get the vaccine. And
Mhm.
so then thinking about other community leaders, other ways to build that trust.
Right.
So all of that to say is that we really need its intersection of different disciplines working together, because health is everything. Health is in all policies.
Mhm.
And so we need every sector working together to improve health.
Thank you. That was great. And thank you so much for sharing that parable as well to help us understand that greater and broader idea. So we'll dive right into your forward vision. And over the course of your career, how was your definition of meaningful impact evolved, or how has it evolved?
That's a great question. I will say starting meaningful impact to me as I was going out of graduate school was scientific success in the sense that being able to have a lot of research publications,
Mhm.
having a lot of research funding, potentially getting like this amazing recognition for the research that I do and having an impact through the research that I do. And that was for the longest time my vision of success. It
Mhm.
wasn't until I came to Rice that and I took more of a educational role that I've changed my purpose. I've changed my definition of success to the impact that I have on the future generation. But like research is important, research is impactful, but have found my calling, my purpose to be educating you or others who are going to be the future healthcare providers, future politicians, future community leaders, to think critically, to have a passion for public health, to be kind people, to like just be the future. We see a lot of areas for improvement currently, and I truly do believe that change will happen in future generations. And so my purpose, my calling is making sure the future generation is what I would envision, like what I would want the world to be like.
Definitely. Thank you. And looking ahead, what do you see as the most pressing opportunities to advance equity in nutrition and health behaviors?
The most pressing opportunities, I don't know if it's tied. No, pressing opportunities would be navigating misinformation and disinformation.
Hmm.
And I
Definitely.
think especially when it comes to social media,
Hmm.
academics, public health professionals have been very behind, and
Hmm.
we don't have the same reach as influencers, but we have to find innovative ways to reach different populations. Like we're not going to reach them through research articles. We're not going to reach them through my courses, right? Like we need to find ways to reach larger populations. I think so misinformation, disinformation, and that intersection with social media is where like a very pressing issue.
Absolutely. And I 100% agree with you. As a Gen Z individual all over social media, I can definitely speak to the amount that I've seen so many different items and ideas talked about that don't necessarily really have that research backup to them. And it's very, very easy and appealing to just believe everything that you read and see, even for a lot of influencers to sell products that can then be marketed as ideas to quote unquote improve health. Right now, there's a big trend of improving gut health that's been out there. So there's a lot of different products that are being promoted and not necessarily products that have enough research backing to them. So definitely, as you spoke, we hope to see that being a sector of improvement for sure. So before we wrap up, I just like to ask a reflection centered question. What is one belief or practice that you've reevaluated over your career? I know you talked about the idea of what success meant to you in that science aspect, but is there a belief or practice that you've reevaluated?
I would say I grew up in a very conservative household,
Hmm.
and public health itself has really made me question some of the values that my parents were trying to instill in me. And so like this idea of like not victim blaming, this idea of really thinking about social issues and the importance of like collectivism, this important issue of how important it is to tackle social issues, because those social issues are connected to health issues. They're connected to economic mobility. They're connected to access to education. Like there's so many things that are interconnected. And so I think over my life, and I'm still learning and growing, is being open to learning from people, hearing about different experiences, and being empathetic. And that's something that I would say wasn't taught to me growing up. And so like that's something that I've had to reflect on and change in my life.
For sure. Thank you so much for sharing that with us. And then, Dr. Diep, is there a message you would like to share directly with the next generation of public health leaders and future healthcare professionals?
I would say keep going. You're the future. I know there's a lot of uncertainties right now, but you are the future. Don't be afraid to think outside the box, to innovate, and to keep pushing forward.
Thank you. That's an awesome message. And Dr. Deep, thank you so much for sharing your insights and journey with us today. Your work continues to shape how we think about public health, community engagement, and the role of cultural understanding in improving health outcomes. For those who would like to learn more about your work, is there a specific website or platform they can visit?
Yes, so I would say that my faculty website would be one to visit. So that's kinesiology.rice.edu, which leads you to the department webpage, and then you can go and find my faculty page. You're also welcome to connect on LinkedIn. I wish I had a stronger social media following. I should take my own advice, right? And try to be an influencer or something. But no, my social media presence is not professional related at all.
No worries. It's very hard to keep up with social media presence as well. So thank you for sharing that. We're truly grateful to have had this conversation with you, Dr. Deep, and to amplify the story of someone advancing equity at the intersection of science, culture, and community. We hope today's conversation sparked reflection and affirmed that youth voices and mentors are essential to building a more just and responsive health system. If you're ready to take the next step, visit projectunitynfp.org to connect with changemakers, explore student-led initiatives, or get involved with future episodes. I'm Hargun Sachar, and on behalf of Project Unity, thank you for listening. See you next time on On Call.